Well, going to an amusement park or just getting out of the house may be something you're looking forward to now that things are reopening. But how risky is it? Eyewitness News reporter Maury Hirschgordon headed to the experts for answers on which activities put you more at risk and which ones are safe.
Well, during the past week, more and more places are continuing to allow it to be open in Rhode Island and Massachusetts. Some of those include movie theaters, museums, and even casinos. But health experts in our area want people to know that the risk of a spike only increases. Phase 3 is a step in the right direction, but local doctors say we're far from out of the woods.
Doesn't go away just because we flatten the curve once. It will come back.
Laura Foreman, the chief of medicine at Kent Hospital, practical in her views as we begin to return to, quote, normal activities.
One super spreader in the state away from having an exponential growth of the coronavirus.
With that in mind, here are the 3 keys she says to assess which activities are safer than others.
The more space you have between you and other people, the safer it is. The fewer people you're around, the safer it is. And the shorter the duration of time that you're around them, the safer it's going to be.
She goes on to say among the safest activities, going for a walk or bike ride, ordering takeout from a restaurant, or relaxing in a park. The one common theme? Space.
Yes, outside would be in general considered safer because there's more airflow, more air dilution compared to inside.
Places with high volumes of people, low ceilings, and poor ventilation are in the moderate to even high risk categories. Some of those are small stores, coffee shops, and bars, as well as hair salons and gyms.
You know, even though you feel well, you need to realize you might be a carrier and spread it to other people, and that older person may get sick.
The only reason we've been able to flatten the curve so far is because people stayed home and they stayed distanced, they stayed out of work, they stayed out of bars. So now that we're opening back up again, there's a very high risk of the curve growing again.
And I also asked them about their thoughts on schools. Both doctors agreeing that schools are in the moderate risk level, both saying there's not enough information out there right now as to how students would get from class to class safety. However, they did say the benefits of in-person learning for students could far outweigh the potential health risks. In the control room, Maury Hirschgordon, Eyewitness News.